Hello, how are you? This is Unetta Spring of Springforth Counseling coming to you with a new video. So I'm not sure if you saw my first video, but it was 10, what was my first video? Oh, 10 signs that it's time to seek therapy. All right, so that was my first video. So my next one is going to be 5 ways to find a therapist that's right for you. Okay, so y'all ready? Let's talk about it. I've just started this page and I wanted to get on and share just foundational information about seeking therapy, finding a therapist, things like that, because I get a lot of questions. I know culturally we really don't talk about therapy, and we're really getting to that point where the stigma is starting to kind of crumble a little bit. I love that. I consider myself a stigma breaker, so we breaking stigmas with these videos, y'all. So y'all ready? All right, let's go. 5 ways. Y'all gotta stay with me, okay? I'm new to this. 5 ways to find a therapist that's right for you. All right, so first and foremost, let's talk about the elephant in the room, which is money. Okay, money and finances, right? This seems a little icky sometimes to talk about, because when you work in a helping profession, it is the idea that sometimes people hold the idea that money is secondary and money isn't important. But listen, y'all, money is how we kind of make it from day to day. Okay, so when you're going into therapy and looking for a therapist, I think it's really important to know, how do you plan to pay for this? Okay, because therapy isn't free. In some cases it may be, and we'll get into that, but for the most part, you may need to know how you plan on paying for your therapist. Okay, so one of them is EAP programs, so employee assistance programs. If you work and you have an employer, a lot of times they will have this program where they'll offer you 8 free sessions, 6 free sessions. Some people have 10 to 12 free sessions. So it's good to check with your employer and see if they have an EAP program and if mental health services is connected to that program. If so, what you can do is get the listing of, you find out who your EAP provider is. Okay, so once you know, because sometimes, I'll tell you guys, sometimes your EAP provider is different from your medical provider. So say for instance, you have Blue Cross Blue Shield for your medical benefits. Your EAP benefits may be some other random name that you've never heard of. So it's good to inquire, who is your EAP provider. Once you know who your EAP provider is, then more than likely they can give you like a list of all of the providers which are in their network. And then sometimes you can ask them, hey, if I find a therapist that I really want to work with and they're willing to see me, will you guys cover out of network benefits? And in some cases they can, and they'll just have like a form or some background information to get from your therapist, and then they'll cover your sessions. So that's the first thing you can use, like EAP benefits if you have an employer. You can also use your regular medical benefits, right? So one thing to look into is who the mental health provider is for your medical benefits, right? Because sometimes EAP providers and mental health provider, they're different, right? So it can get confusing. And one thing that I know is, if you're in a mental health, like if you're in a crisis or if you're dealing with a lot, sometimes like trying to look up one more thing or explore one more thing is just like the last thing that you want to do. So I definitely want you to get the services and get the help that you need. I don't want it to be so confusing that you're like, you know what, forget it. Okay, we don't want that to happen. So I'm trying to give you some information to kind of help this process move a little smoother, right? So then you have sometimes out of network benefits or out of network providers. What that means is your therapist may not accept your insurance, but they're out of network provider. What that could mean is that you pay for your sessions up front, and then you submit a super bill, is what it's called, to your insurance company, and then your insurance company will reimburse you what they would have paid for your therapist if it was in network or whatever the case may be. So that's one way. Another way is some therapists accept sliding scales, which means if you meet certain criteria, certain demographics, then they will offer sessions at a reduced rate. And then you have therapists who you pay out of pocket. Okay, you want the services, you find a therapist that you love and that you want to work with, and they are a private paid therapist. And I'll record another video to kind of share with you the benefits of having a private paid therapist, but that's another way. So it's clean, it's easy. You come in, you make your payment, you have your session, you go on about your business. You also know that if you use your insurance benefits, that there are certain stipulations to that. So there are certain things that the insurance needs to know to justify making the payment, whether it be a mental health diagnosis, whether it be like treatment plans and things like that. So when you utilize your insurance, you do open yourself up to having some of your information is at the will of the insurance company. So they kind of want to know. They want to justify why I'm paying for this service. Okay, so keep that in mind. All right, so that was long, but that's number one. Know, how are we going to pay for this? How is this going to happen? Know that sometimes on college campuses they offer free sessions. Sometimes if you have like community mental health agencies, if you meet the criteria, that you can have therapy for a reduced rate or free sessions. So there are multiple ways. So just kind of giving you an idea of some different alternatives and some different ways that you can pay for your therapy. All right, because we want you in therapy if you need it. All right, so on to number two, okay? Find somebody that you connect with. Oh my goodness, connection is everything, right? So therapy is relational, right? You wouldn't just hop into a relationship with anybody, would you? Maybe, maybe not, no judgment. But know that there has to be something that kind of clicks, right? You have to feel comfortable to some degree. Not completely comfortable, because like I said, therapy is relational. So over time, you may become more comfortable with your therapist. But it's very important to find someone that you feel comfortable with talking to. Listen, y'all. In therapy, you may be sharing things that you've never shared with anyone before, right? And that can be more difficult if you feel like, I can't trust this person, or I don't feel like this person understands me, or I feel judged by this person. So first and foremost, it's important to know that it's okay to find someone that you feel comfortable with. Know that there is going to be some discomfort with doing something new, right? But you don't want to push yourself to just or force yourself to like open up if you don't feel that level of a little bit of comfort. Okay, so therapy is relational, so find someone that you feel comfortable with talking to. And connection is important, so it's also important to find someone that you feel like you can connect with. There's nothing wrong with that. Okay, all right, number 3. Now listen, do not just play any, mini, miny, mo when you're choosing your therapist. That's a no-no, okay? Read the profile, okay? So there's different places where you can find therapy profiles. You can Google therapists in my area, and it'll pull up therapists that are close to you. You also have Therapy for Black Girls. That is an awesome, amazing platform. You can go on and put Therapy for Black Girls, and it'll give you a list of all the therapists that are in their directory in your location. They have therapy for Black female therapists, Therapy Den. There's also Psychology Today. Okay, so you have all of these different platforms where therapists, they go on, they put their profiles on there. They put what they specialize in. They put what type of clients that they work well with, because that's important, right? It's mutual. So if you want somebody that you feel comfortable with, therapists also have to have a client in a population that they're not only skilled and qualified to work with, but that they feel comfortable with as well. And that just makes for a better therapeutic experience, okay? So do not play any, mini, miny, mo, okay? Don't go and say, oh, I like that, you know, it's important. Profile pictures are important, and that's important, but it's also important to get the meat of the matter. Like, get in there, read the profiles. If you feel like, when I read this therapist profile, I feel like they are talking directly to me, then that may be somebody that you would benefit from working with. Okay, so it's okay to kind of look through profiles and read the profiles. That's why we create them. Like, we work really hard with making sure that we put the information out that's going to appeal and going to touch and reach the people that we want to serve and help. So read the profile, y'all. Okay, read the profiles, and also, like, reach out. Okay, so read the profiles. No any, mini, miny, mo. No, oh, I like that shirt. Or, oh, her hair is pretty. Oh, that person looks creepy. Because connection is important, but also, not being super judgmental. Because if you are, you could miss a really great opportunity to connect with someone that specializes in exactly what you need. Okay? All right, so number 3, I kind of mixed number 3 and number 2 together, but we're going to keep it moving. Find a counselor that specializes in what it is that you're dealing with, okay? So if you feel like I'm dealing with anxiety, then find an anxiety-related counselor, a counselor that specializes in anxiety. If there's an eating disorder that you have, then find a counselor. Listen, these counselors have gotten special trainings, went through specific courses to help you. So find the counselors that deal with specifically what it is that you want help in, okay? If you are a black woman and you want to talk with a black woman because you feel more comfortable with a black woman, or with a black male, or with a black therapist, or if you're Latina and you feel more comfortable talking with a Hispanic therapist, you want to be able to communicate like in your native tongue, and you want to be able to not feel like you have to translate those things. That stuff is so important, y'all. So I don't want you to minimize that and feel like you have to just conform and go see whomever. More than likely, there may be a therapist that fits you and that can meet you exactly where you are. It just may take some work, exploring and investigating. So find a counselor and a therapist that specializes in what it is that you're dealing with, right? If you have a heart issue, you're not going to go to a foot doctor, right? You're not going to do that because you have an issue of the heart. If you're having problems with your vision, you're not going to go to a pediatrician. Like, that doesn't make sense. It's the same thing with therapy, right? So you want to go to a counselor that meets you where you are and that specializes in what it is that you need. Okay? All right, and number 5, be open-minded. Okay, more than likely, if you're seeking a therapist, in most cases, and not all, this may be the first time that you've tried this. This may be new to you. This may feel unfamiliar. It may be scary. So just allowing yourself to open your mind just a little bit. Okay, just a little bit. Open your mind and being open to new experiences. Focusing on what it is that you can gain from this experience versus how uncomfortable this is going to be, or how weird this is going to be, or how bad this is going to make me look that I'm in therapy. Focusing on those things is just more than likely going to push you further and further away from getting the help that you need. And that's not what we want, okay? We want you to feel open, to feel comfortable with getting the help that you need. So opening your mind a little bit, like reducing some of the judgments that you have about people who go to therapy, because you may be that person. And sometimes that's what makes it hard, because sometimes we have all of these judgments for those people, that when we start to have a hard time and when we start to struggle with things, we automatically associate with some of those judgments that we've had for years. And now we have to put ourselves in that position, and it doesn't feel good, right? So if that's been you, if you've done that, listen, it's okay. I encourage you to still get the help that you need. All right. So there you go. There are 5 ways to find a therapist. Was that the name of this video? Do you remember? 5 ways to find a therapist that's right for you. Did you see how I sneakily look down at my paper because it is there, and because this is my first video series, bear with me. I'm getting you all the information that I feel that will be beneficial. Hopefully it is. If it is, feel free to like, share, follow this video. Feel free to subscribe to this YouTube channel. And I am so looking forward to connecting with you. So if there's more information you want to know, if there are different topics you want to hear from, want me to cover, if it's something that's within my wheelhouse, I'm more than happy to share a video with you. You all have an amazing day, and I will catch up with you next time. Bye.